Anyway, I'm very excited to be on this call again, and I've spent an inordinate amount of time, worthy time, on this topic because cardiovascular disease is such a big topic affecting so many people. I even have a story I want to share with you, but it is something that's important. And I should share a bit of my background because before I went into facial plastic, I also did ear, nose, and throat surgery. Before that, I did cardiovascular thoracic surgery. So I actually did open heart surgery. So I know a fair amount about this disease, how prevalent it is. But again, I was looking from the surgeon's perspective. So this time we're going to look at a completely different perspective, which I'm very excited about. And I'll tell you why, obviously, in the call pretty soon on the webinar. Now to get on for sort of the meat and potatoes of the show. So cardiovascular disease, or we'll call it CVD sometimes, is the primary cause of death in developed countries. Coronary artery disease is one of the most common causes of disability and death in the U.S., affecting over 15 million people. And that actually number is higher now. That was a few years ago. Approximately 1 million people die each year in the United States from heart disease. So it's talk about a pandemic. This has been around for many years. Coronary arteries are the blood vessels that come off the aorta, which is a big artery off your heart, and nourish the heart muscle. When there's a block in these arteries, then the downstream heart muscle will be injured. We call that ischemia. The greater the ischemia or lack of oxygen, the greater the injury to the heart cells, or myocardial cells. That's the name of heart cells. This is what we refer to as a heart attack, or MI, which is myocardial infarct. The main artery to your heart is the left anterior descending artery. This supplies blood to your left ventricle, which pumps blood to your entire body. The right ventricle really just pumps blood from your body to your lungs. So it's kind of much shorter distance. So that's a much smaller blood vessel, or much smaller ventricle. If the heart muscle recovers but is still not normal, then the heart could have rhythm problems, such as, we call arrhythmias, such as atrial fibrillation, ventricular tachycardia, lots of different problems with the rate or the rhythm of the heart. This damage can also cause heart failure. That means when the heart's pumping ability is poor, so it's trying to contract, it's poor. So instead of your heart pumping out, say, 60 to 70% of its contents of blood, which is really good, it could eject, say, 40% or less, which is bad. We call this percentage the ejection fraction. That means what percentage of the blood is pumped out of your heart, which you could tell easily on a cardiac echo, which is that thing they run over your heart like an ultrasound. So heart failure can lead to poor energy, shortness of breath, or simple exertion, fatigue, lots of problems that just basically your ticker is not able to contract enough and get enough blood through your body, so you feel like really sluggish. So again, these are all things that stem from having a problem with your coronary arteries. Of course, there are traditional medicines and surgery for these conditions, such as drugs to tame your arrhythmias, to open the blood vessels and help your heart muscles contract. Surgeries include coronary artery bypass, heart valve replacements. As I mentioned, I've been trained on cardiac bypass surgery, valve replacements, and even I've done heart transplants in the past. However, once this disease gets hold of you, it's not easy to reverse it. As a surgeon, I could only treat, of course, one patient at a time. I would love if I could help thousands of people at a time. And that's, of course, the main idea is to prevent heart disease, which is where Cerule comes in, which is really what we're talking about today. Wouldn't it be way better to treat thousands or millions of people at a time before they even get a disease than to wait till you have a problem, and then you have to go see a physician and have to have some invasive thing or take cardiac meds. So that's really a big part of this. And Annie and I have been talking about this a little bit beforehand about how we don't really want to wait, right, till you get symptoms like angina, chest pain, that your coronary arteries are bad, or wait till you have a stroke and because you've been hypertensive for years, something like that. So really taking Cerule products every day is going to minimize the risk for that. And I'm going to back that up with a lot of scientific data in a few minutes, but that's really important. Okay. And then, so basically what causes the arteries to block in the first place? So obviously there's fatty diets lead to higher bad LDL, low density lipoprotein. I'm sure have all heard of LDL. which gets deposited in your artery. So they get into the artery itself and plugs it up to narrow it. This is called a plaque in your heart vessels. This causes narrowing and thus can lead to a heart attack. How do you improve your diet? Reduce saturated fats and trans fats. So in other words, eat less red meat, less dairy products if you can, and if you do, drink low-fat milk. Cook with vegetable oils, less fried foods. Eat whole grains, fish, nuts, vegetables, and reduce your sugar intake. Smoking and sedentary life and high blood pressure. Well, sedentary lifestyle reduces your good HDL. And if you have less HDL, that means there's less of it to remove your bad LDL from your arteries. So the good stuff actually gets rid of the bad stuff. So you want to have obviously less of the bad stuff and more of the good stuff. The American Heart Association recommends about 2 to 3 hours of moderate exercise a week to lower your cholesterol and blood pressure. There was a question here about Cerule to repair after a heart attack. Yeah, or heart disease. So yeah, anytime we can improve our heart cells or the myocardial cells, that's going to be a bonus. So I'm going to talk about that actually in a minute. So I saw that question being asked. So that's a good question. But I'll go through this first. So smoking lowers your good LDL too. It also constricts, which means tightens your small arteries that feed all the cells of your body, because that's where the small cells end up. You get big vessels, the little vessels, small vessels, and that's what perfuses or diffuses your blood into your cells, which leads to the oxygenation. So this can lead to ischemia and worsen other risk factors. It's like throwing gas on a fire. It just makes things worse if you smoke. And of course, it leads to lung disease and shortness of breath, which worsens heart problems. Okay. As I discussed in a previous webinar, obesity lowers the good HDL and raises the bad HDL. So it leads to diabetes and increased inflammation. How do Cerule products help reduce heart disease risk? And what are some new innovations in heart treatments? So I've researched numerous medical papers on the ingredients of Cerule products and how they help cardiovascular disease. So the first paper, and tomorrow, tomorrow or the next day, I'll post these, because I'm in surgery tomorrow, but I'll post the references so you can all have access to them if you want. It's in the Journal of Medicinal Food 2013 by an author named Ku et al. Health benefits of blue-green algae, which is basically spirulina and AFA, phycocyanins, prevention of cardiovascular disease and non-alcoholic fatty liver disease. So they quote that the National Center for Complementary and Alternative Medicine in 2007 estimated that 38% of adults in the USA use complementary medicine over conventional drugs, particularly for cardiovascular disease. So I think that's a really big market here. So obviously that number is increasing. So that's a huge market to know that Cerule needs to be and is a big part of that. And then there's a term called dyslipidemia, which means dys in medicine just means bad or not going so well. Emia is the term at the end, means in your blood, so lipids in your blood, so which means high blood levels of cholesterol, triglycerides, LDL, and a lower HDL, which is the good one. And these studies, both rat, mice, and human studies, show lipid-lowering effects of spirulina and AFA. So that's why, which are the main actives in SEU and Cyactiv. So I'm going to talk about SEU and Cyactiv, and then we're going to talk about Plasmaflo at the end. The American Journal of Therapeutics in March 2009, Ryan et al. Said there was a clinical overview in 16 clinical trials, algae and diets, again based at spirulina type products, reduced triglyceride levels up to 26%. It included subjects who were also on statins. And that brings to my story. So I mentioned in the past that my family history has heart disease, but they did smoke, my dad and his brothers and so on. The diets weren't great. They didn't exercise regularly. They had a pretty stressful life, but I don't have any of that stuff, but have inherited genetics, obviously. So I am on a statin, and I was on 20, but now I'm on 40. So I'm looking to reduce that to 20 and then get off it. But obviously now that I've been on Plasmaflo and Cyactiv and SEU, I'm looking to recheck my cholesterol levels and see how I can wean off of that. So I'll keep you posted on that. In Science Advances in 2017, Cohen et al., this is a Stanford study. This is a very cool study that I was kind of shocked, actually. It's out of the thinking outside the box. It's pretty cool. It's called Innovative Biological System for Photon-Powered Myocardium in the Ischemic Heart, which means they're trying to figure out how to weigh that light makes hearts work better after they get damaged. I mean, it's pretty amazing. They got their idea, the main surgeon, when he was realizing that dying heart cells needed oxygen, and I think he was thinking about plants in his garden, and he realized that plants gave off oxygen and take up CO2, which is the opposite of humans. So they took a chance and found that algae cells helped rat heart cells survive longer when they injected the rats with algae extract. So rat hearts were subjected to a lack of oxygen, kind of like a heart attack, and the ones that received algae improved oxygenation 25 times more than those getting placebo. The implication is that algae improved heart damage in humans who suffered from a heart attack. I think the study is actually just genius. So, we're thinking, about this right now with Cerule and all its products and how it can help our daily lives. These guys are thinking we can take products like, Plasmaflo and Cyactiv and SEU, and that's going to actually, improve oxygenation. If you can improve oxygenation in your heart cells, especially if somebody was asking me after they had a heart attack or atrial fibrillation, where again you don't have a good blood supply to the heart muscles. Imagine if these products, which they're obviously doing, according to now the study, hopefully there's a follow-up of the study from 2017, that could show that AFA, spirulina is going to increase the oxygenation of our myocardium cells. So yes, there was a question about somebody had a heart attack or a mild heart attack. Should you take that? Well, I would absolutely take it, because that's going to improve your as an antioxidant and anti-inflammatory, as well as improving oxygenation. The next one was Lipids in Health and Disease by Torres Duran, 2007. Anti-hyperlipemic, which means fat in your blood, and antihypertensive effects in spirulina. This was a Mexican study. They took 36 subjects, took spirulina for 6 weeks. Cholesterol, triglyceride, and good HDL all improved as measured. Obviously, they drew blood samples. So they had 36 healthy volunteers, 16 male, 20 female between the ages of 18 and 65. And they had ingestion of spirulina at a dose of 4.5 grams, which is very high, for 6 weeks total. And then this decreased total plasma cholesterol, triglyceride by 10% and 28% respectively. So obviously that was significant. Lipoprotein analysis showed that the HDL cholesterol was increased by 15%, which is a good one, and the LDL cholesterol was significantly decreased. In addition, both systolic and diastolic blood pressures were significantly reduced in both men and women. So that was very impressive. And they mentioned that back in the year 2000, hypertension, high blood pressure, what they thought was about 13% in the general population, and 6 years later is 23%. So obviously it's on the rise there, just like it is in a lot of countries. So it's something that we need to be very diligent about, making sure you need to get your blood pressure checked. You need to have visits. You need to have checkups as well, to make sure, or if you have your own blood pressure cuff at home, that would be great. That's very valid to have a diary, write down your blood pressure every day or every few days or whatever, just to keep it. Obviously try to do it at different times of the day. So say you always do it in the morning, or then you always do it at night. So that's important. So the next study was the Journal of Cardiovascular Pharmacology, 2006 by Khan et al. Rat studies in India showing that when a rat heart cells are exposed to an anti-cancer drug, and I know we're not talking about cancer, but this anti-cancer drug, which is doxorubicin, is a well-known drug to cause, as a side effect, damages heart muscle. Spirulina protected the cells from becoming damaged. So I think that's a very potent piece of information to know that it's cardioprotective. The American Journal of Physiology and Heart Circulation, 2005, Khan again, phycocyanin, which is basically spirulina, protects against ischemia reperfusion injuries in heart muscle. When heart cells are damaged, in other words, they try to recover and the blood flow tries to reestablish itself. This leads to further cell death. We call that reperfusion injury, meaning the flow of blood coming back into the cell, into the heart. So spirulina minimizes damage in rats. So that was really, again, we talked about somebody asked a question about heart attacks or small heart attacks and things like that. If you have this thing where you have reperfusion injury, so this is showing, now it's a rat study, but the implication obviously is that if it can do it in a rat, there's going to be definitely some implications and improvements in humans. So I thought that was pretty cool. The next study was Nakaya et al., cholesterol-lowering effects of spirulina, 1988. Apparently, this is the first human study carried out with 30 healthy male volunteers with mild hyperlipidemia, I mean fat, or hypertension. The 30 subjects were divided into 2 groups. One group received 4.2 grams of spirulina daily for 8 weeks, whereas the other group was given spirulina for 4 weeks, followed by regular food for another 4 weeks. Intake of spirulina for 4 or 8 weeks significantly decreased total serum cholesterol, and the decrease was more marked in mild hypercholesterolemic than normal cholesterolemic subjects, which makes sense. So the worse you are, the better the improvement. Discontinuation of spirulina, this is interesting, a supplement after the 4 weeks in that one group resulted in the returning of the cholesterol level to baseline, and HDL levels are slightly increased, but not statistically significant. So in other words, you need to be on the stuff continuously. You need to keep taking products. You can't, it's like general health. You can't just take it for a month or 2 or 3 and then expect you to completely, get better. You need to, it's like general healthy diet. You've got to keep on the products continuously. So that makes a lot of sense. But it's interesting to see that when they shut it off, when they turned it off, stopped the spirulina, the cholesterol started coming back up. Now the next part is obviously we want to talk about Plasmaflo here. So I mean, the research on this is really pretty extensive, extremely extensive. Dr. Jackman has written and gone through all of the ingredients in it to show the really, and a lot of science, I mean, I can't tell you how many papers, I can't remember. It's got to be 50, 60 references in this, in the description of the active ingredients in Plasmaflo, which he wrote and documented back in August of 2018. And so if you don't have that information, we should be able to get that for you. Obviously, that's something that is really awesome. I decided to pick 2 of the main ingredients. There's others, but today I could talk about some others later. But Centella asiatica is one of them. This is an ancient plant, has been used in Ayurvedic medicine from many, probably centuries in India and Thailand and other parts of Southeast Asia. There's, in the evidence-based alternative medicine journal 2011, Matto et al. From Thailand University called Kon Kane, if I'm pronouncing that correctly, faculty of medicine. They had 80 subjects. Average age was 65, ranging from 55 to 80, and mainly females were randomized in taking Centella asiatica or placebo for 3 months. They assessed the functional abilities and strength of subjects. So they checked sort of getting up from chair, sitting up, standing up, walking, hand grip strength, different strengths, and daily living activities in people that they said was in this sort of older group, which I think is kind of funny because I'm in that group. I'm 65, but I do CrossFit and mountain bike and play ice hockey. But anyway, and I'm going to be a better hockey player when I get back on the ice when they let us after taking Cerule products. They assessed the functional ability. They found interesting the lower body strength, meaning legs, lower legs, thighs, calves, had improved more than the upper body strength. They felt that was because it was increased blood flow to those muscles. So it's a different type of muscle in the upper and lower limbs. And so, in other words, the blood flow increasing blood flow obviously increased their muscle function, so they showed a real physical benefit to these people in their activity of daily living with Centella asiatica. And it also reduces free radicals, so it reduces oxidative stress, so that could be obviously contributing to some of their improvement. And then the other one was the citrus bioflavonoids. This is Archives of Internal Medicine, which is a big deal. That's a well-known medical journal by Hertog in 1995. So it's an older article, but it's very interesting because that flavonoid intake is called long-term risk of coronary heart disease and cancer in 7 country studies. So they had 16 cohorts of people over 25 years. So it was a really long-term study. The average intake of antioxidant flavonoids was inversely associated with mortality from coronary heart disease. I'll say that again. Average intake of antioxidant flavonoids was inversely associated with mortality from coronary heart disease. In other words, the more flavonoids people consumed, the less likely they were going to die from heart disease. So that was a very cool study, because it wasn't just 3 months, 6 months. This is a 25-year study. So, and that's a main ingredient in Plasmaflo. So that's something you all need to be really feel good about taking that. So again, maximize these doses. You saw in a lot of these studies the dosing of the spirulina. If you look at obviously StemEnhance Ultra, the serving is 2 capsules, and there's almost 500 milligrams. So you're going to need 4 to 6 to 8 kind of capsules to come even close to the dosing that they're using. So obviously there's a huge safety parameter in taking higher doses. As you know, I'm a big believer in dose response curves, meaning how much can you take before you see a real effect. And if you're not having side effects, then obviously you're doing well. And then if you start really noticing improvement, then stay on that note. But if you think you can get more improvement, increase the dosing. I think that's important. That's what I've been doing, is upping the dose to see how healthy I can get. So again, I think the take-home story today, because I've done the sort of scientific stuff for today, and I can answer some more questions, and maybe Andy will remind me at the end, is that cardiovascular disease or coronary heart disease is pervasive, as we know, and it's very important to not wait till you get symptoms. You really want to be healthy as much as you can right now. Eat healthy, exercise, don't smoke, get rest, minimize your alcohol intake, and take Cerule products to the maximum dose that you think you need to really kind of get to that level. So that's really important.